Hey everybody, this is Asia. I'm gonna vlog this because I'm going through a really scary event in my life. I have, ever since I had gotten pneumonia in July 2025, we are now in October 2025. My life has been flipped upside down. I can't, doing little things like walking, brushing my teeth, even texting now, makes me out of breath. I've been to the ER over and hospitalized. Total hospital visits 8 times now. I'm on welfare, so my insurance is not listening. They're not doing anything. I still have not been treated for pulmonary hypertension, and my symptoms are getting worse every day. I went from being able to at least walk around a little bit with my walker and do things without too much shortness of breath, and now I can't even. Right now I just took a shower, and taking a shower takes a lot out of me, so it's a lot of shortness of breath there. But I've gone to 2 different ERs departments. Sutter was terrible, and Castro Valley, don't ever go there. But Stanford at least tried to ran more tests. Doctors still can't find what's wrong, which is terrifying. So, I mean, the things that could show up is pulmonary hypertension. I keep telling them I can't drink enough water. Water. They're like, you're not dehydrated. I'm like, why would I make something up like that? Nothing I say they believe. My life is turned upside down. I can't work. I can barely take care of myself, let alone my 3 boys. I'm pushing through every day, though. I make sure my kids have everything they need. I keep getting bad primary care provider after bad primary care. I'm on my 4th primary. And clearly I haven't been treated. I keep getting bad referrals. And then the referrals I do get, they're unprofessional. They're just really bad doctors, like very unprofessional. One of the pulmonologists that I saw came in high, nodding in the appointment. Doctors are not telling me. They're saying nothing's in my test, and then I look at my test and I see things that are startling, and I'm like, well, this could be contributing. I know I'm not a doctor, but why would you say there's nothing when I'm seeing stuff? So there's that factor. As you can see, my hair is matted because raising my arms right now, it pulls. It feels like I'm pulling, like my heart's being pulled. That's the same thing with getting up, sitting down. That wasn't a thing until maybe, I would say, the last few weeks. My symptoms are getting worse. My lips are dry. Whenever they try to get a vein, I'll show you. This happened yesterday, where my veins keep collapsing, and the contrast got trapped, and they had to stop the test mid procedure. But this is a swollen arm. This is my regular arm. don't know if I can't compare both because I'm holding the camera. But I felt the urge to vlog this because if something happens to me, I want you guys to know that I did my best. I've been trying to fight. My insurance won't even get me a caseworker. They're dragging their feet. It's been 2 weeks now. Urgent requests of urgent. I've filed probably up to 20 grievances at this point. Nothing's being done. My new primary won't write me a doctor's note, won't look at my chart fully. She hasn't asked me. She hasn't even examined me, actually. She sends in the nurse. Very dismissive, impolite. Not concerned about what I'm going through. Why am I coming to her office in a wheelchair? My history. Nothing. I asked for, she tells me she can't fill out my continuation of care disability form, even though you're continuing my care. And my symptoms have not gone away, they've gotten worse. I've had to switch over to disability now because I no longer have sick leave. But now my disability is in stake because the doctor won't send in the form. She says she needs a specialist to diagnose me, even though she failed to send in my referral to a pulmonologist. And the diagnosis has been in my file with the pulmonary hypertension since July. It's there. I also have an enlarged heart. It's there. So it's not like I haven't been diagnosed already. It's there. It's in my chart. And I just asked her, please look at it. You don't need to wait for anything. It's there. But she refuses. And she's mean, rude. They ordered blood test results, her and her nurse, and they refused to look at them. And when I asked about them, they said, you have to make another appointment for that. Once again, I'm stalled. I'm not getting the care. My health is getting worse. ER department can't help me because I'm not actively dying, according to them. According to them, I'm not having a heart attack. I'm not having a stroke. So there's nothing they can do. And that my primary care provider is the responsible party and a specialist. But I can't get the care from either one of those. This has been since July 2025. It is now October 2025. I have been trying to push through this quietly and alone. But I feel like I have to speak out because nobody hears me. Nobody believes me. It's the most terrifying thing. My life is on hold. I was in the process of enrolled in my first university right now to become my dream, which is a teacher. And I can't even. I have to medically withdraw. My job is, I can't go to work, and I love my job. My job brings me joy. Can't go. Because I can barely walk now. I was fine before July. I was running around, losing weight, eating better, determined. fighting, making sure we kept a roof over our heads. My kids got what they needed by the grace of God and family and friends. I am terrified. I am absolutely terrified because I feel my body shutting down. And nobody can give me an answer. Nobody believes me. And I don't know what to do. If you know of a good primary provider in the Bay Area, California, that takes Medi-Cal, Alameda Alliance specifically, please let me know in the comments. My current doctor, who didn't put in the referral the first time we met, which was October 1st, well, the nurse, because she won't even see me. My actual doctor won't even see me. But the nurse that she sent in was supposed to put it in. It was pulmonologist. It was neurology, because I'm always dizzy. And I'm a fall risk. And other specialists. But those are the two top that needed to go in as soon as possible. Nothing was ever put in. I went in a week later. Nothing. So I had to fuss about that. They argued with me about that. And then they put it in. I called a referral. They sent me to an OBGYN for a pulmonologist. I can't make this up. So my baby sister Maria, big shout out to her. She's been advocating for me on the sidelines as much as she can. She's been calling my insurance for me, calling providers for me to try and get her big sister some help. And she has no idea how much that means to me, because I have no one else other than myself, and I don't have the strength, y'all. I'm losing strength. I want to give up. What do? You can't rely on, when you're having chest pains, can't breathe, feel like a brick is on your chest. By just sitting. What do you do? What do you do? I've been praying. I pray. I pray every day. I pray, Lord, please show. Cardiologist said nothing's wrong, and he was real mean, real brash. But he wasn't thorough. He couldn't even tell me if I had an enlarged heart or not. So I don't even know. He didn't test me while he didn't really put, it was a heart stress test, but I sat down the whole time. So I don't know how that's stressing the heart. Beyond me. But again, I don't know. Like now, I'm like, I don't believe myself anymore. I don't know what to believe. I know I can't breathe. I know I can't. I'm literally running around all the time. And it's just stopped. My whole world stopped. Just stopped. I'm wheelchair dependent now. When I go out, can't use my walker. I used to push myself and use the walker. But I get so weak now that I can barely walk a few steps. And somebody's trying to say, oh, it's your weight, it's your weight. Baby, I've lost about 30 pounds at this point. And so I was heavier than I am now. And I never experienced that. I don't have asthma. I never had respiratory issues. I had never had none of this stuff. It has nothing to do with that. And like I said, I'm losing weight. My diabetes is more in control. I'm almost at the diabetic goal. I'm at a 7.3, and they want you at a 7.0. Last year, I was at a 13 A1C. You can't tell me nothing. It's not that. My anxiety and stuff like that, you can't tell me that, because I'm being seen by therapists and stuff like that. I am being treated for that. I'm okay with that. It's not that. I can't make this up. Why would I want to ruin my entire life for nothing? My dream was right in front of me, and I feel like it's taken away because I can't. I was on my way to get my bachelor's, to do something that brings me joy every day, and that's teaching little kids. And it's ripped away from me. And I can't find a doctor that will listen to me. Or care. The ER treats me like trash. Like I said, if I'm not actively having a heart attack, they just throw you away. And because I'm on Medi-Cal, that's the extent they go. I am so alone. Y'all pray for me, please. Yeah, I can't breathe. I'm trying to move slow because I'm out of breath. I'm going to do a breathing treatment. I do have an in-home nurse. My doctor won't even talk to her. And this was provided to me by Stanford. Of this service. I have a physical therapist now. They've been actively tracking me, so they're witness to it. But nobody will hear them or talk to them. It's terrifying. What I'm going through is terrifying. I'm seeing people I considered close to me or family members just not care. Make me out to be an inconvenience. I keep hearing, don't play the victim. I'm not playing the fucking victim. I've always fought through my pain. Anybody else would have blew their head off at this point. Especially with my mental issues, but I'm still fighting. I got 3 boys that depend on me. And if I won't fight for myself, I'll fight for them. Sometimes I don't even think God hears me. When I say I miss my work, I try not to think about it. Because I feel I'm being replaced at work. I feel like it. I've missed out on so much. I don't even hear from my work family no more like that. Some I hear from, and it just brings me, it gives me a little bit of peace to know that I'm not forgotten. What do you do when you feel like you're dying? Genuinely. And nobody believes you. What do you do? My husband don't even believe me. I know that's genuinely you. That's the honest to God people show with their. I'm not even gonna go there. But what do you do?